Greetings everyone. Welcome to the second day of our training, which is an application of GIS in the public health management. And we are going to start right away with introduction to GIS and remote sensing. This course is offered by Spatial Engineering Online Homeschool alongside Africa Environmental Watch Board and Tech Service Africa. So the module 1 of the course, Introduction to GIS from RS in Public Health. So what is GIS? GIS stands for Geographic Information System. It is a science that tries to answer the question, where? It is a science of where. Yes. GIS and geo-identify, geo-localize, give us the ability to geo-identify, to geo-analyze, to geo-visualize, and to forecast the event in a specific or in a defined geographic location. So what are we going to see? We are going to see the overview of GIS technology and RS. We are going to see the importance of GIS, RS in public health. And we are going to discuss also the historical context and the evolution of GIS in public health. The course instructor, me, Armstrong, which I'm a GIS remote sensing expert from ASTI, Nigeria, which is affiliated to the United Nations. Okay. So, Geographic Information System, we want to define GIS, Geographic Information System, and remote sensing are two powerful tools that play a crucial role in public health. Here is an overview tailored for public health expert. So the definition down here, we look at the definition. GIS is a framework for gathering. We go to the field, we gather, managing, and analyzing data rooted in geographic context. So we go to the field, we collect data, and we create a spatial database with a GIS system. Then we analyze the data, so it gives us that, and it gives us that leverage to collect data. So we are going to discuss we are going to discuss the component of GIS. So before discussing the component of GIS, let us see what is GIS in public health. So we said GIS, as far as public health is concerned, it gives us that leverage to geo-visualize how spatially the affected cases are widespread. And we can be working on a project, and it can be an epidemic or a certain outbreak of a communicable disease. And we want to geo-visualize, we want to see how the affected cases are spatially spread. So just give us that capacity to go out there, collect data on these people. Then we now come and we now visualize how they are spread. It can be in the community in Kumba. We now see how the affected cases are widely spread. They can be clustered together, and they can be randomly spread. They can follow a defined pattern. So GIS, from then now, we can now use our GIS software, which is a spatial analysis software. We can now do some analysis to geo-identify hotspot. We can also go forward to also correlate the epidemic and the environmental attribute, environmental characteristic. That also help us to geo-identify or to geolocate the cause of the epidemic. And from there, GIS also gives us that leverage to model an epidemic and also to forecast where there's a high likelihood that the epidemic or the outbreak can be attacked. So we want to see how we can use GIS. We can go to the field, collect data. Actually, here we're not going to the field. We are going to use an interface of we're going to use a software which is let's see, we're going to use the software. We are going to use Google Earth Pro. Yes. If I go there, click on Google Earth Pro. We are going to use this Google Earth Pro to see how we can collect data in the field. Okay. We are going to launch it. Let me just close here. Close. And let me see. I want to go to Kumba, to the town of Kumba. I'm going to search here. I want to look for a community in Kumba. I'm going to type, let's say Kumba. Okay. But I said Kumba. There's so many Kumba in the world. Kumba, let me just process Kumba, Cameroon. Kumba, Cameroon. So I go down there. I take Kumba, Cameroon, and I say search. So it now takes me to Kumba. The Google Earth Pro now takes me to Kumba, Cameroon. So with Google Earth Pro, I can see all the towns, all the communities in the world. Now I'm there in Kumba. This is Kumba, Cameroon. I can also okay. So you see, we can be working on a project. Maybe you are working on a project as an public health expert in this community, and you happen to go to the field. You collect data on the affected cases. At the end of the day, now you can collect data now. GIS can now be used for you to visualize how spatially or how spread the affected cases are. Then how on the proximity to affected cases with some geographic and some geographic features. Here, let's say we have a stream. If we zoom, we have some sort of a stream here. We can zoom. We have a stream. We can have industry, so we can take coordinate. We are coming to discover coordinate now. You can take coordinate of point. You can take coordinate of point. You know, and what are coordinate before we continue? What are coordinate? Coordinate in the very basic way. Coordinate numerical values that define the geographic position of every object on Earth's surface. Every object on the Earth's surface has a coordinate. Wherever you're sitting now, it is being defined. Your position is being defined by its coordinate x and y. You understand? If you move, let's say you're still in your office. If you move from your table, your position first, your initial position x and y, let's say x and y. If you was 1 and 2, if you move from your table, let's say you move like 4 feet or 4 meters, 2 meters away from your initial position, then your coordinate also will change relatively to your movement. So if you go out there, you go, let me see, you see in the first household, you ask, there was an affected case. Let's look at this house. There's an affected case here. You take the address, all the information, the name of the person. Of course, with your smartphone, since the coordinate, how are coordinate calculated? Coordinate are calculated with the help of the satellite. You understand? The satellite, when you put smartphone, there are apps that gives us the coordinate, the geographic position of that house you have collected the data. Let's say if you come here, now, you notice something. Here on this Google Earth Pro, you notice that I'm moving my mouse, my cursor. You see these numbers down here are changing. So these are the coordinates. You're going to see something like 32.54. So this is the x and this is the y. You also see some value 546,582 point. You understand? Then you see m point. So the value is what we call UTM coordinate. That is universal transverse mercator in meter. So this coordinate are in meter. We can have coordinate in meter, UTM in meter. So this 32, what does this 32 mean? This 32 means that, and the world has been divided into imaginary, horizontal, and vertical lines. You see, the world has been divided into imaginary, vertical line. And Cameroon happens to fall on the line between 32 and 33. If you are going towards the north of Cameroon like that, you will be around zone 33. And we all know that Cameroon has a tropical zone. It's found in the northern hemisphere. So you see the continent here, you will see all continents here when you're walking in places like the southwest, mostly in the southwest, littoral, central, northwest, west. You always be seeing continent, your continent will always show, your zone will always show zone 32. But if you go towards the north of Cameroon, you'll be having zone 33. Okay, so here it tells us coordinate of this house. So when you place my cursor here, I cannot come here. You will see something like ajouter un repère. Ajouter un repère means you should place a reference. Okay, you cannot place a reference. So okay, this is why I collected my data, this house. You see, now when you go there, this is the coordinate. You see, x and y coordinate. This is the x and y coordinate. So let me say, if I just name it like can we say APA? Yes, APA, the patient's name. Let me just give it APA as for an example. APA. So we have APA. Let's say you move here, you collect a name, let's say jute. Let's say jute. Okay. If you move now, so you now see how they are spread this, how spatially spread this and affected cases. You see APA, you see jute. You can now, and let's say you have another cases here. We have, let's say, Maryland, something like Maryland, like this affected also. So at the end of the day, we can now see how those affected people are spread partially with their phone, but with their phone, since you're working in the field, you're not working in the field with this software. This is how I just want to demonstrate. If you go to the field, you can, if you collect data, this is how they're going to fall. There's phone, there's an app, we're going to work on how to collect data. We have no yet reached that point. We just want to explain everything globally. So you can go to the field with this an app you're going to install. You can collect XY coordinate of each point. Then you can now come now, you upload or you import the data here. You're just going to see how spatially spread they are. Then you can now take everything out to just create a map. So GIS permits us to geo-visualize. One of the most important is GIS permits us to geo-visualize. So now we can now use on all the data we have collected, we can use on some spatial statistic technique to map out hot zones. So we can map out hot zones using some spatial statistics technique. We are going to see the spatial statistic technique that we can use to map out hot zones. Okay, because we know that hot zones will be geo-defined relatively to the affected cases. So if they are highly and how far they are dispersed to each other. So the hot zones we can use this data to identify hot zones. Yeah, if we can have a data here further away from jute, we can have another data further away from APA. So we can have a data here. So hot zones will likely be around here. Anyway, there are so many statistical models that we are going to use alongside we are going to model hot zones. And also GIS also has, as earlier said, we can use it to forecast zones that can zones that will likely be affected by the epidemic. Yes, and also we can correlate the epidemic and some environmental attribute. There can be environmental features like a string where people usually go there together. Yes, this now takes us to the geographic, and this now takes us to the history. We are going to discuss about the history of GIS and public health. Okay, so that was just it. Now let's go back to the component of GIS. Okay, the component of GIS. So GIS comprises of hardware. We forced to do work with GIS, we need the hardware. Software, we need software, the software of GIS. So what do you install in your phone, in your laptop, in your desktop, like ArcGIS? We have ArcGIS desktop, we have QGIS, those are the most common. What do you just install? ArcGIS 10.7 or 10.8. It's what we known as, what is generally known as ArcGIS desktop. So we also have ArcGIS Pro, we have a different version. They also have QGIS, which is an open source. ArcGIS is not really an open source, it's a licensed software. So we are working with a crack version of it. Then we have QGIS, which is an open for educational purpose. We are working with a crack version of it. We can also carry out some research work with our ArcGIS. The thing is no big deal there. But when it comes to heavy projects, since it is not a license, we are obliged to pay for the license software to work with it. Then we can carry out our heavy research work with it and educational work with it. It's no problem. But when we want to do some work that will go within some international organization, those things I really want to put it clear. We are obliged to have a licensed software. But with QGIS is an open software. It's an open source software. It does basically it does everything I just will do. Yes, and it is an open source. You can work with it in no matter the project, any international project, you can work with it without any problem. So we're talking about technology as we talk about the hardware, we talk about software. Then we talk about the data, spatial data, maps, satellite imagery. So we can be working with satellite imagery like what I just presented with Google Earth Pro. Those are satellite images with high resolution. We also have the type of satellite data that we're going to see. We have satellite data that are multispectral satellite data, which we can use to analyze map pollution in a certain zone. We can use to map pollution. We can use to map air pollution, water pollution. So you see how powerful GIS and remote sensing is. So we have said GIS is Geographic Information System. Why RS is remote sensing? And what is remote sensing? Remote sensing is actually the technique of collecting information of an object or an area without going directly, without getting direct contact with the area. So, I can be here and I can carry out the project in Kumba, I can carry out the project in Manfi, I can carry out the project in Edea without going, let's say there's a community in Edea, I want to study the air pollution in that community, maybe because of the industry, I want to study the air pollution or the water pollution. I can use my remote sensing technique, that's what we call big data. The spatial satellite image, which is known as multispectral satellite image, it can be Sentinel, it can be Landsat. I can use this data now to map out, to evaluate the level, the rate of pollution, air or water pollution in that area, which we know that pollution is very, very linked to public health. So now, importance of GIS and application in public health. Yes, important number one, we have disease mapping. Identify the distribution of disease to understand their geographic patterns. Epidemiology analysis. Analyze how disease spread within certain population and environment. Health resources allocation. Optimizing the distribution of health services by mapping the location of health facilities and the population they serve. So we can actually map out all the health infrastructures, and we can create what they call spatial database in each hospital or clinic, and at the end of the day we can do some sort of spatial analysis or buffer to see how proximate, to measure how proximate the proximity between the health infrastructures and the population. How many distance they need to walk, or they need to trek from the population center to the different health units. So all these things we are used to managing, we are now managing introduction, all these things we are going to do. Then now, epidemiology analysis, analyzing how disease spread within a certain population and environment. This now takes us back to the father of epidemiology, the father of spatial epidemiology, before the term spatial epidemiology, which is John Snow, is known as the father of spatial epidemiologist. He was the first to map out disease, map out the spread of disease. That was some many decades ago. That's the history. Getting into the historical context. There was a certain outbreak of cholera in the town of London. Now, what happened is that many people, and there are many cases, there were a lot of reported cases, and what happened is that at first, cholera was new, the epidemic was new, and research, and back then, thought cholera was airborne. So what John Snow did was he went around, collected information on affected cases. He collected their address, every details. Then he came now and he mapped out on a big sheet of paper. He tried to place all the affected cases on a piece of paper relative to the address. So he was trying to mark out everybody relative to the given address. So he now noticed that and most of the affected cases, were clustered in a certain locality. So he went now, he said, okay, so he thought that there must be something common. There must be something common there must be something common with the affected affected cases. So what he did was he went now, he collected and he went there, he created a questionnaire to ask the people what did they have in common. And the people said what they have in common normally was a pipe-borne water where they usually carry their water to drink. Okay. So now they now have to conduct a test. They now have to conduct a test now. They now have to conduct some tests on the pipe-borne water, and at the end of the day it shows that the pipe-borne water was contaminated. So that was when they now discovered that cholera actually is being provoked by contaminated water. So from there now, Johnson was able to correlate the epidemic and the environmental characteristic of that zone. So that's what GIS does. GIS, we go now, we collect how spatially and the affected cases are, how spatially their space. We can now define the pattern of the diseases, and we try to see the correlation between the disease and the disease and the environment. If they are not closer together, mostly they are not closer together, we can now try to understand or try to find out the cause of the certain outbreak, which we can. There's a lot of model we are going to see. At the end of the day, we can also see not only find out the cause. At the end of the day, we are going to see how we can map those that are likely to be affected by this epidemic outbreak. So John Snow actually was the father of spatial. From his work, that was where spatial epidemiology was born. So now we can now talk spatial epidemiology thanks to John Snow. Yeah. So we are still on the theoretical concept of work. Okay. So importance and still on importance and application of GIS in public health, environmental health, assessing the impact, environmental health, assessing the impact of environmental factors, e.g. pollution, water quality on public health. So we're going to talk about that. Emergency response, supporting disaster management by visualizing affected areas and resources, facilitating timely intervention. So as we go now overview of GIS technology, as we have earlier said, remote sensing is simply the science and the technique of acquiring information on an object without being in contact with that object or area. So by definition, remote sensing involves obtaining information about an object or an area from a distance, typically using satellite or area image. So here we're going to use satellite images and area images. Area images here can be drone, which is known as airborne images, which are drone images, and we have space-borne images, which are satellite images. And we're going to see different types of satellite images. There are many different types of satellite images, which as a researcher or as a scientist, you'll be using to analyze water quality and pollution. Application of remote sensing in public health. Application in public health. So we can do disease surveillance, monitoring environmental factors that contribute to health issues, e.g. monitoring temperature and humidity for vector-borne disease. Well, yes, another powerful what we can do with satellite images is we can actually map out temperature. We can easily map out temperature or temperature increase, like and we can do what they call spatial temporal analysis. Like last year, 2024 was reported to be the hottest year since the International Panel of Climate Change started recording temperature. So 2024 was recorded the hottest year. So we can actually use remote sensing to carry out a spatial temporal analysis within 9 years, because when you can go to their, what happened, what am I trying to say? You will notice that when you go to the site, you upload slide images. Maybe you want to upload slide image, Landsat, there's different types, Landsat, Spot, Sentinels. We have images since from 1984, 1984. You can have images from 1984. So we can have different images of different years. So different right up to 2025. So with those images, you can do some predictive analysis. And you study the trend of temperature increase, humidity increase within a certain community, and so on and so forth. I can also study the soil vegetation cover, etc. So there are a lot of things we're going to see. Application of remote sensing in public health. Urban health. Study the effect of urbanization on public health through the analysis of urban heat, ice, and air quality. So as we were talking, when we want to study the spot, we want to do spatial trend or spatial temporal analysis of temperature increase on urban heat, ice, and so we're going to see how urban heat, ice, can tamper with the public health or the health quality of a certain locality. Yes. Disaster management, assess damage from natural disaster, monitor recovery effort using stellar imagery. So disaster management also, yeah, you can use like disaster. Probably the common disaster management we have is flood. Whenever there is flood in the community, there's a likelihood of an epidemic broke out. So we can actually use GIS to analyze, to forecast, or to come up with, to map out, to come up with some sort of vulnerability maps of a locality. So we're going to see those things. Integrating GIS and remote sensing in public health. Combining GIS and remote sensing enhance public health resource by providing spatial analysis. Spatial analysis identifies spatial relationships and patterns that can inform public health strategies. Real-time data, using remote sensing data for timely insight into emerging. Real-time, we're going to talk about that. Predictive modeling, we're going to talk about that. I don't want to go into those contexts now. Challenges and consideration. Data quality, the accuracy and completeness of data can significantly influence our analysis. Yeah, for the data quality, we are just talking about challenges. Sometimes you have challenges in the field when you want to collect and data. Maybe sometimes we know that this our phone, we are collecting data with our phone. It sends signals. Actually, what it does is it sends signals leave the satellite. Signal is the satellite to our phone and or to our phone to give to the geographic coordinate of an area. So sometimes there can be perturbation of signals on some different communities, and that also will affect us to collect data on that community. But that seldom happen. But there's probability that it can happen. Also, when we want to download slide images, maybe we want to download slide image on a certain locality, and maybe like when you're going towards Boya, you will notice when you're looking like here, if I go back to data quality, let's just talk, if I go back to Google Earth, you will discover if you go to a town like Boya, you will discover since we are here, look here, one can visualize on the town of Kumba, all the communities, we can see everything is, you see, everything we can have, when you see here, because of cloud cover, we are unable to see what is happening here. It might be that if you want to study all the geographic pattern here, you can say, yeah, we have vegetation cover here. But because of cloud cover, we have problems to visualize what's happening there. Let's go to Boya. So data quality, let's see how study image can. Yeah, this is the town of Boya. You're going to see that even those here, you're going to see that part of Boya is, if you're working in the community in Boya, here in Boya, you're going to see that part of Boya, you see, because of the mountain, so the satellite could not really get some localities. We will start out in Boya, we can get some localities, we can get clear slide images. If you're working in this community, which is if you're working in this community, you can easily get data. But if you're working in a community like this one, You see, we cannot get nothing, we cannot see building, we cannot appreciate how and the widest how dispersed our collected data is. We cannot even visualize some geography, some physical, other physical features, maybe river, stream, vegetation cover, all those stuff. We cannot do it. So part of what we are is part of the idea. We can see everything, what is happening here. We can compare the environmental characteristic with our collected data here. Yes. So that falls under data quality. So accessibility, ensuring the public health professional and health skills. Also another problem now with data quality is if you have the necessary skills, maybe you go to the site you want to do some GIS analysis with the collected data in the field. You have the necessary skills, or if you don't have the necessary skills, you can also hinder or change. Can also hinder the work. So you have to make sure that you have the necessary skills to collect data in the field, and you have to make sure that you have the necessary skills to come to the GIS software and create your database in a way that will be spatially located and in a way that we can do the analysis and the necessary modeling. The ethical consideration. Let me go back to presentation notes. Ethical consideration, addressing privacy concerns related to health data and geographic information. That one has the side of the professional context. Consider ethical, can be defined legally. The ethical consideration when carrying out geographic information system related to public health. Maybe there might be some things that they want to keep within the system or within, Okay. So by in the way of conclusion, GIS and remote sensing are integral to modern public health practice, facilitating effective decision making, resource allocation, and strategic planning. Their application leads to improved health outcomes through better understanding and management of spatial health issues. Public health experts must stay abreast of advancement in this field to leverage their full potential effectively. We're going to see all those things. We're going to see all the things. Of course, generally, of course, will be practical, entirely practical. So I just want to use today to discuss because we have to discuss on to show the theoretical. Okay, so that was just it for the overview of GIS, introduction to GIS remote sensing in public health. So we can also go and look at the history of GIS and public health. You can start looking at the history since the early day of the early 1960s to 1970s. We start seeing the origin of GIS, can trace back to early computer mapping. You can the role of GIS in public health. Then the history of John Snow's cholera map in 1854. We can 1980 advancement in technology, growth in spatial health from 1980s, 2000 public health initiative on GIS application in the 2000s. We now see that many international organizations are making good use of GIS. The World Health Organization, International Panel on Climate Change, and many of them are making good use of GIS and remote sensing in their domain. Even NGOs now, most of NGOs now is a big advantage for GIS, for health experts to have a mastery of this technique. Okay, thank you.